relationship, and I have Dr. Rob Eubanks and Dr. Andy Brown here. And we're just going to dive into the topic because this is basically the foundation, the vehicle that all things ride in when it comes to therapy. As a biased person, when it comes to how much I love the relationship and think it's important, I say when it comes to all things go through the relationship. It's the connectedness. So let's dive in. Let's start with what's important about the beginning of your work together, the beginning of the relationship. What would you say is the important factor there in how you start the relationship? Anybody wants to jump in?
Anyone?
I'll hop in. So for me, that makes me think about the first point of contact, which is, I teach this as kind of this is the doorway that clients walk through first, is typically a phone call. Well, an email these days. And then that is followed up oftentimes with, a phone call, a short 15-minute introductory session or whatever you call it, before meeting the client. And whatever it is, that first point of contact is that's where the relationship, that's the foundation of where it's built. Mm-hmm. How are you responding? What sense are you giving them of who they're going to be opening up to? Students always have to remember, and I always tell them this, that clients are coming in feeling very vulnerable, very depressed, very anxious. They have a lot going. Who just goes to therapy for fun? Nobody. There's a lot going on in their lives. So they have to be met with an experience that is open and welcoming and warm and comfortable and like, I found somebody. And so that phone call or that email response is first and foremost. And what's most important for me is your authentic self being clearly visible and creating that sense that, I'm with a real person, not with someone who's going to be giving me a prescription or be telling me what to do or be judging me for who I am or what I'm coming in with, because I'm coming in with a lot and I just don't, I don't know who to tell. I've never told anybody this stuff before, so put yourself in that mindset and that will help you adjust to, who you need to be and how to approach clients. So.
I think when you say that there were so many little nuggets, I feel like they're like little diamonds to pull out of the ground. It starts at the first contact. Like the idea of we're just going to sit down with someone and that's when it starts. It literally starts at first contact. Like the seed of where it grows is so much earlier, I feel like, than most people would stereotypically think of where a relationship starts. But then the other piece is, yeah, they do come to you are seeing someone, not because they're like, hey, I thought it'd be fun to go to therapy today. Like literally, I always say we're like the last step or the last resort. Where do you go first? You Google. you ask your best friend. You ask a family member. My God, if you're really that worried, you start asking your neighbors. You ask anyone around you. You try to look it up. ChatGPT, I feel like, has now become another entity in that long line of I'll ask this person before I ever even consider getting counseling because it's such a vulnerable state.
I think I look through the lens of, trauma treatment, which is something I do quite often, and the process that we're aware of called neuroception, and it's people's proclivity to take in information, split-second information, and make a judgment. And I think that's incredibly important when you're dealing with sensitive clients, because when they come in, they're assessing, is their brains are scanning their environment for safety. Is this safe? And I think where we offer that safety initially is through the context of the relationship. And without that rapport, without that relationship, I'm not sure that safety and stabilization, certainly safety, is not obtainable in the context of the therapeutic environment. So I think it's like probably the sine qua non of what we do is working on that relationship in the beginning, especially when you come to, looking at clients that have been traumatized or have, sensitivities to therapy in general.
Absolutely. The safety piece, I think, is the biggest, especially when I think of traumatized clients, for sure. And the fact that they're, likely they're coming in because safety has been violated. Now, like, it's completely looking around, making sure that everyone you come in contact with is safe. So Dr. Eubanks brought up the authentic self and how when you meet with someone, that's the way to cultivate that sense of relationship. Dr. Brown, you mentioned safety. How does someone start to cultivate, I feel comfortable in the therapist role just to be myself and not put on this script of like professional self, let me give you this. It's almost like this line or this script or this mask of I'm me in this role instead of just being the authentic me with you. How does that happen?
That's a, yeah. That can be a tricky one, because so I'm an actor. That's one of the side things that I do, and one of the hardest things in learning to be a good actor is to stop acting and to be in touch with how Rob would be portraying this character in this situation, not portraying the character so much as like, how would I be responding angrily or sad or whatever. So it's the exact same thing with being, going in, being a therapist, having that label, wearing that hat comes with so much expectation that you put on yourself. And so what I tell people is don't be the therapist. Stop being a therapist, at least for a while, and see what that feels like, and just be yourself. And this is revolutionary to a lot of people, because it's like, why am I in school? Why am I like learning this stuff and getting a master's degree? Theory is important. We've got to know how to do treatment plans and structure sessions and hold conversations that are, 50 minutes long because we got clients in the waiting room. But during that 50 minutes, what's most valuable to clients, and we know this through research, which we'll talk about in a little bit, is that you can be a real person first and foremost, and throughout the session and throughout your relationship with the client to the end. So let me pause for a second because I just lost my train of thought.
He's being authentic.
I love it. I'm digging it. I'm digging it.
All right, so yeah, so coming into that place, being that Sarah, I've got long COVID. That's something I've been dealing with for since September, and so I like brain fog is like it's horrible.
Okay.
I'm in therapy now, so it's like I've been dealing with a lot this year. Anyhow, let me leave it there.
It'll come back.
Yeah, with the authenticity so vital, particularly, I found when you're working with the youth, like adolescents or whatever, they can just smell people who are being disingenuous. If I'm bringing things into the moment and into the now, of course, it's challenging when you see the record light come on to present your authentic self, because you're like, this is going to be captured. Who's going to see this, that kind of thing. For me, when Rob said, the first thing about being an actor is know when not to act anymore. And I wanted to jump in and say, and we're still waiting for Rob to stop acting, and we don't know who he really is. That's more of my authentic self, but the record light's on. So, come across in some sort of professional manner or whatnot. Okay, so what we realize now through, further research, we know like the basement floor of, a building a relationship may start with Rogerian, Rogers theory and stuff like that, and authentic, being authentic is certainly a large portion of that and whatnot. But it doesn't stop there. And what we realize now, and what I didn't learn in grad school, is that the therapeutic relationship is also a very real relationship.
Yeah.
It's both very real and it's very professional at the same time. So if somebody cuts you, you bleed. If someone dies, you grieve. It's a very real kind of relationship. And it's also professional, so, these are people we're not going out to a movie with later, or whatnot. So, how do you walk that line between, the authentic self and also the professional self? And, so I'm being the authentic professional me. And when I'm meeting clients, I think, and when I'm wearing that hat. So I may say something when I've developed a rapport like what I just said with Rob, but I wouldn't do that until I know them well enough to know that they can accept that or accept my humor or whatnot because of the professional part of what I present.
I was talking to someone the other day, a gal that I've just started working with, and we were talking about how different it is to recognize, especially in the beginning of the profession, like you recognize that theories are important, you recognize that understanding the model, understanding the progress, and understanding the framework and all this, you recognize it's important, but you don't recognize the level of art that truly exists in balancing that professional and that real, so that authenticity and like how it's not, I almost would say it's like not even a mask. It becomes this woven tapestry of between who you are and you in the professional role. It like it almost like melds together into the art. So you have that authenticity, you have the professional, almost like these background components that are always moving, but it's still who you are. And I've had someone say the other day, they said, I have a feeling that the way that you are right now is a lot like the way you are in your therapy role. And I said, yeah, they're pretty similar. They're pretty similar. They're not very different in some ways. But I think that there is this, I think it's a hard piece to recognize in the beginning because your brain is trying so hard to understand and apply all these other things that you're learning and all your experiences. But at some point you get to a point where you're like, oh, but you're also a human and you're sitting with a human. And I love Charles Figley said, like essentially our role is mainly to bear the pain of others. And so if you're a human and you're bearing pain of others, you must be human to receive and to carry. Like that's the kind of thing it kind of it brings up in my mind.
Yeah. So a couple of the techniques that I tell people to, in terms of getting in touch with their authentic self, and that's what I love about this field, is that it requires, to be a good therapist, you've got to really figure out who you are and how you function in the world and work through your own issues and be okay with that, so that you can come forward and bring that fully into your therapy sessions. But I'll tell people, just, think about, how do you talk to your friends? How do you talk to your family? How do you talk to partners? That is the true authentic you. Why would you be any different in therapy? Now, of course, it's got to have boundaries, like Andy was saying. And but I tell students to record themselves. So just set a phone down and like go sit and, talk with your friends at the coffee shop, and then watch it, and just like, you're relaxed, you're laughing, you're focused, you're asking great reflective questions. It's just like, all that stuff's there. You're coming in with all of these components already loaded in, because most people that are in this field have good relationships in their life, have stable long-term relationships, and they know how to function in society and get along well with people. That's the stuff that you just more intentionally bring in to create the therapeutic relationship, and you hold and sustain that throughout.
It's Andy brought up Rogers earlier. He's the one that I remember saying and listening to him say, like, basically, if you're an effective human, you can be an effective therapist.
Yeah.
If you're not functioning out there in the world, you're gonna have a really hard time in here, because it's the creation of it. So that's an interesting piece there, that they kind of connect together in that way. Like if you're yourself and you're working on which speaks to self-work as therapists. Like if you know who you are and you you know, have those connections and relationships, then you are essentially, the role becomes this like ease into a place of who you are, transfers and just into a productive self. And that's the real difference. It also makes me think, I had a student a week ago ask, how do you remember all of this stuff when you're a client? And I'm like, do you have friends that they tell you their story? Do you remember their story? Like, do you see them next time and you're like, I have no idea what we talked about? No, you're like, oh my God, what happened with Jenny at work? What was it? What went down? You know? So it's the exact same thing. Like, just continue to connect in, and the memory will come when you're interested and you're, you know, engaged with another human. Okay, let's transition it a little bit. How do you take the relationship and moving into what I would say like the working phase of therapy, where you're possibly going to have a rupture, or you're possibly going to have conflict or confrontation or something that kind of comes out of that working phase that usually isn't the pretty shiny parts?
But one of my very wise colleagues once said, there are no resistant clients, only resistant therapists. And of course, that was Dr. Eubanks who shared that as a bit of wisdom. And it's something that I latched onto because my knee-jerk reaction to that was, you don't know my clients. And but as I really kind of delve into that, really kind of jumped into that, I could see the wisdom in that, because there are people where they're going to come in, they're going to be resistant because naturally they want to stay away from the pains that they've been through and how that's going to impact them to kind of share those things. And I don't think we'll ever really know, or people don't really know what it's like to emotionally undress in front of someone until they've been in therapy themselves. And I think in going through that process, which is something that I recommend for any young therapist, or any therapist at any stage, I think it's very a wise move, is to really kind of understand the process. It's helpful to understand both parts, and to understand that if somebody is resistant, if somebody is pushing back or whatnot, our natural inclination may be to feel rejection, or like, why is this person not sharing, or why do I feel like I'm pulling teeth, or what have you. But understanding the process of therapy, I think, kind of helps in the working part of the relationship phase of therapy, and really kind of exercising that extra empathy and understanding, more so than I would probably outside of therapy. If I was talking to Rob or to Sarah outside of therapy or whatnot, and they were doing that thing where they were being coy or pulling back when I knew that there was a problem, as Sarah was saying, it's fine, and the way she's saying it, and it's not fine, then I might just let it go because I don't want to pull teeth with her. But when you're sitting with the client, you're looking at, how do I approach this in a genuine way, and in a compassionate way that creates the kind of atmosphere that they'll put down that tug of war rope, and share that. And I think that's so important when you get to that working portion of the relationship, and in the working portion of therapy.
Good points there. Yeah, that was actually a quote from a professor of mine in my doctoral program. Can't remember his name right now, but yeah, that's led so much of my work through the years, because whenever I sense what I would judge to be, they're not wanting to go there or talk about that or whatever, it's an instant reflection back on me of, wait, what am I doing here to create this? Because they're not ready to go to this place or talk about this thing yet. And so I need to, like, what am I expecting from them? Why am I asking these questions now when clearly they're not ready? So let's back up and kind of go some different directions here that they're ready to go. It's really, so much needs to be client-led. It has to be client-led. It's therapist structured, but client-led. And I think that's really, once we have that mindset, we will stop creating resistance in clients with our expectations and judgments, and pushing our therapy models, into this direction of like, okay, well, this is according to CBT, we need to be doing this now, and kind of like Maybe they're not ready to do that yet. Maybe it's 3 sessions in when they are. Be okay with that. That's really, really vital that you learn the pacing based on the client's abilities to find comfort in you and find trust and safety and non-judgment and all of that stuff that's vital for them to sense first, rather than your timeline. Like, God, 3 sessions, like we haven't even talked about why they came here. It might be 4 sessions, it might be 5. If they keep coming back, they're getting something out of it. And it might just be building more runway, before they're really ready to take off, with therapy. And you've got to be okay with it. One of the most important pieces of research that came out in the 90s and has continued to, there's thousands of articles published on this now is the client factors. I was very fortunate to have a guy named Barry Duncan as one of my professors in my doctoral program. And 30% of change is accounted for by the relationship factor in therapy. That's huge. And 15% is accounted for by technique. That's small. So your wonderful theories that you learned in these great techniques and everything, they're not going to land. They're not going to be meaningful. They're not going to be impactful if first and foremost and throughout is that therapeutic alliance. So that's, I think that's a real awakening for a lot of people who are getting into this field, and it should be.
Yeah.
I was gonna say, I had no idea that you worked with them. That's pretty exceptional. I think that's pretty cool. Like, I didn't know that you got a chance to work with them.
Yeah, lots. Yeah.
Sorry, great. Andy, go ahead.
Rob likes to name drop. He's very important.
I mean, Freud and Fritz Perls and
hanging out with Freud and we were having a cigar. But anyway, yeah, I was kind of, segue into that, and I think about the metaphor that I know that Sarah's heard this, but if you're watching, sometimes a neophyte or a younger therapist and whatnot on video, and they outrun the relationship into the intervention, because interventions can be sexy. You go to school and you do the continuing education, and this is, man, I can't wait to do this intervention. This is really going to land. This is going to help the client or whatnot. But they outrun the relationship, and it's like if you've ever had a Coke where the top has been left off for like 2 weeks and it's just flat and there's no evanescent quality. And that's what it looks like when you're watching a video and someone's outrun their building of the therapeutic relationship and they've gone into interventions too quickly. I've also seen a lot of people who have had failed therapeutic interventions with other therapists, especially EMDR and some of the power therapies or whatever, when they've outrun the relationship and they've gone, into the power therapy without developing the rapport and the safety and stabilization. And, it can be re-traumatizing for people. And I also think about countertransference issues and stuff when we're looking at the complexities of the working part of the counseling relationship building and whatnot. And I can remember a rapport that I had with the couple. It's a slightly older couple, and every time I saw them, I'd have this like ick feeling in the pit of my stomach. And it was one of those where you kind of celebrate if they call out, like, "Oh, you don't want to come? No, that's fine. No, there's no fee. Go, go to," just like you'd celebrate, when I end work early or whatnot. And I was like, I had to get in touch with what that was about, and I had to do some self work around that. Saw one of my mentors for a couple of sessions and kind of working through that. And what it came down to, this couple reminded me of my parents, and they were coming to see me because of, sexual issues. And I mean, some people talk about sex open in their family. They're sitting around the dinner table and, how was your latest orgasm or whatever. That's not how we rolled at my house. And so it was very uncomfortable for me. And I was like, oh, but because of that, I couldn't, it would impact the relationship. And that's where this is really kind of going, is that being, that self-knowledge, that understanding, that deepening your understanding of self, I think is so vital and being able to extend yourself in that relationship to the clients in a meaningful way.
The there's so many pieces to that, and
You're welcome.
like
I wanted to open several doors here.
I saw it. Like
work
there's
it.
so many doors. Like I'm like, oh my gosh. I'm gonna go backwards because it does make me. Who was it? Who was it that used to always say interventions are sexy? And it used to always turn my head like when he said it. Bishop, Dr. Mike Bishop. And I always thought, oh, but it is so true. As you bring that up, I thought, oh yeah, that is true. Like if you don't have the relationship as the vehicle and it gets out, the intervention just runs down the road. It looks like a crazy person. It lands very, very awkwardly. Doesn't arrive the way it's supposed to.
Well, yeah, you think about it, it's, like introducing sex too early in a relationship, it's the same, the same kind of outcome.
Yeah, absolutely. It's just, I don't know, that like brought me back to, oh my God, yes, because it's not a manual. Like this is not like let me just, again, it goes back to like, I cannot think of the balance of like the art and science. Like if you just keep applying a science and you manualize this process and you're like, it's been 2 sessions. Okay, it's time. We're just going to get into intervention. The 3rd session, we're going to be doing this. The 4th session, I mean, there is literature around like if you any of the manualized approaches, you drop your positive therapeutic outcomes, like whatever is going to happen at the end of therapy by 50%. If I know going into something I'm going to fail by 50%, wow. Like so it has to be the balance of the art and science and where to apply that. And I think Rob, you really pulled that out of like the client has to lead us and the relationship has to lead us. If they're not ready, they're not ready. But the countertransference piece, definitely want to open that door wide open. Because I think that to me is a huge thing of what I see is like when we're scared to talk about a subject or when we're essentially holding something back and the client keeps leading us there, but then we say things like, well, they're not ready, or I think that we'll do that next session, or like the clients here, they're ready, they're willing, they're saying, grab my hand, let's open this together. And we're more like, let's talk about the weather. Did you see that game the other night? Like, I just feel like the countertransference piece of ourselves is often what holds us back, not recognizing where the client is, running past them or not running with them, sometimes running away from them.
Yeah, Figley actually said that it called that, I believe, the silence effect, the silencing effect.
Silencing response.
Yeah, and so you're really kind of altering the conversation with the client to steer them away from something that you were kind of uncomfortable with, certainly.
I feel like I see that the most with grief.
Um,
That's such a hard thing for so many people to open up if they haven't healed their own grief.
mm.
And whatever that loss is, the idea of opening up someone else's loss feels terrifying and sensitive.
Well, you bring up another good point, and that's parallel processing. And going back to the real part of the relationship, and we're real people. And so if you've gone through loss yourself that you haven't dealt with, you're going to get stepped all over that emotionally with the client who is currently going through grief or loss or whatnot. So is being a good therapist, is it even possible without doing self-work?
Oh my gosh, that's a great question. I will remember years, this is probably like 12 years ago, that I worked with a client who had just lost her son a couple years before that. He was young, he was like 8. And I didn't have any giant challenges. No, it had to be 15 years ago, maybe more, now that I'm like doing the math in my head. But I didn't have any giant challenges working with it. Like, and I remember one of my colleagues being like, I could never I don't want this client. Like, I'm so glad that you stepped in. And I was like, why? She's great. Like, she's really like working and she's really open. And I think she's fantastic. We worked through it. We had a really effective relationship, really great outcome to it. Maybe 1 or 2 years after I had my son, and I was at a residency, and that night after a class, I went back and watched this movie. Didn't know what it was. It was just like, TV's on, let it roll. And it was about two women who were like their lives were paralleling each other. They both lost their sons. I cried for like 3 hours. Like I cried for 3 hours. The next morning I woke up feeling like I wanted to cry again. And I was so surprised by that, thinking, well, I've had clients that have lost their son. Like I've seen that face to face, the grief. And then I recognized it. I didn't have my son when I saw that client. Then when I had a son, it changed all of my response to that, because it was then my greatest fear of
Mm.
like, wow, watching the level of grief that she had. And then I thought to myself, and I think I even talked about it in class, if I have had a client come to me now that they would have lost their son, and it would have been the exact same scenario, it would be so different, because it would touch such a terrifying place of myself. And I thought, you always, people think, I think most people think like, oh, I've worked on that, that's done. But as we develop, as our milestones develop, as our lives change, which thank God they change and they grow and they're not stagnant, but as all of these pieces change, our stuff, what we have to work on to prepare to be in this role, also changes. It's never ending. There's not a place where I think we get to this point where we go, I've worked on everything. It's all good. It's all checked off. Like there's no more things I have to work on. It's constantly going to change, especially as we even move. I think of even moving into the phases of our life where we start to lose people in our world, and starting to see that different outcome and different perspective of how the world changes with all of that. So I agree. I think working on yourself, constantly being open to it, recognizing the changing of self is just vital.
Yeah, I mean, I can give a recent example. And so dealing with some significant health issues that have hit me in the past, really 2 years, but it's culminated the past probably 8 months. I've never experienced depression. Like I've been through like down times or challenging places in my life, but like just this perpetual feeling of like sadness, of just like sobbing, of hopelessness, of like all the criteria in the DSM, like line it up. I mean, I'm checking a lot of those boxes. Um, and uh and and so I mean that, at 52, I'm like at 50 of I was like, well, will I ever experience, clinical depression? And it's like, I don't know, 50 years, I haven't yet. I mean, sure, people are going to die, stuff like that. But that's kind of like life changing. I mean, this was out of the blue, and this is how life happens, and what you're speaking to. And so, so it's funny because, at this point in my life, I was resistant to going to therapy because I could figure it out. I've got all these tools. I got, and my wife was like, you really should, this is kind of what your field's about, right? Yeah, but like I'm journaling, I'm meditating, yeah. And it just wasn't doing it. And I just kind of woke up one day, I just felt really strong about like, I've got it. I mean, like, this is what I do. Like, it was just so interesting, kind of the delusion that I was living in. But to come full circle and have entered therapy and been in that for a while now, and how incredibly helpful that was. And I mean, after over 20 years of practicing therapy and like working on my life and stuff like that, it's like, I need a therapist, and it's been incredibly helpful. And I now have I'm so much better tuned in to those experiencing depression than I've ever been in my life, because I've experienced it myself. And very much like, you didn't have a son, you kind of like didn't, yeah, grief, this is, tough, but like now it's like different. And so this depression thing is like, it's experiencing that has taught me so much. At the same time, the value of therapy, has also been a big lesson in this as well too. So yeah.
There's something wonderful about giving ourselves permission, I guess is the right word, to like be human.
Mm-hmm.
And I mean, even though we have the knowledge and we have the training and we have the experience and, all of those tools, like we're still human. We're still going to encounter those. I think there's something beautiful about the idea like that we can still be impacted and still benefit from therapy. That there's never, I feel like there's never really a level of humanness that doesn't need support or someone that cultivates a place of growth. Maybe the Dalai Lama, I don't know. Maybe.
No, but I mean, even he says, all of its opportunities, we constantly encounter opportunities for, awareness, enlightenment, understanding, growth, all of that stuff. Constantly have opportunities for that.
It makes me think too, like when you said you're so tuned in, so many people come into this. I think Andy and I've had this conversation many times that sometimes we can be looked at as like a field of wounded people because we come in with our own histories, experiences, trauma experiences that, turned on this realization of like, I can meet someone in pain because I've experienced it. And there's a sense of tenderness to it. And there is a sense of like, I can tune into it. Like I can recognize that, you're in that raw place of pain because I've experienced that as well. So I think that there's an interesting piece there too, of like, it does dial you in a little bit in a different way, in a different, and not that you have to be coming in wounded, but hopefully you're coming in with scars and not open wounds, but like there's something different about recognizing, that feels familiar in some way.
Mm-hmm.
Okay. Last piece. What do you do to close a rupture that you've had in the relationship? How do you repair?
I begin with owning I'm sorry, go ahead, Rob.
No, well, just Andy does that all the time, so I'm going to let him speak to that because he has a lot of expertise.
Yeah, I have a lot of actual, experience there. And I think first thing is taking ownership, being authentic and being genuine with hey, and I'm also careful, and I would say this to clients too, and you don't want to take false ownership, you don't want to take false responsibility of something that's not your part. But even if I was 10%, like in a lot of the issues with Sarah, 10% of it's probably mine. So I own 100% of my 10%, and so I don't look at the other person and say, well, most of this issue is Sarah's. And so she should apologize. And the same thing with clients, I realize there's a power differential and, it's a real relationship. There are going to be real ruptures. But I also have to be, you walk that line again between it's a real relationship and it's also a professional relationship. And so that allows me to get there, I think, quicker. Sometimes in personal relationships, I might let it breathe a little bit longer before, I'll let, just for those watching, I'll let Rob or Sarah connect with what they've done wrong first. And then I'll approach them with the 10% that was my problem. And I'll apologize for it, own 100% of that. But that is like, just kind of genuinely being open and, vulnerable and connecting with them. Because, some people they may not connect with theirs. Your 10% is the 100% of the issue, and if that's the case, especially with clients, then that's where we're at. But it doesn't negate the fact that I need to own my stuff.
Yeah.
Hand.
It makes me think of, I mean, that's something that we have to also, transparency is one of my core values as a therapist as well too. And if I'm getting a sense that there's something that's like off this week or something that's like, clients typically won't be the first one to bring that up because again, that's another layer of vulnerability that we can't expect of them, that if we mess up or say something or do something that's like, wasn't good for them, why didn't you say anything? That's not a position to put clients in. If something's off in the relationship or just, I'll just ask, things feel a little bit different this week. Is there anything going on, or is there anything that I did, or we talked about last session that, maybe didn't connect with you or anything like that, and just kind of open it up like that and be ready to hear whatever they have to say honestly, without like, oh, I hope they don't bring that up, or they better not say this because that was them, but really going in from an honest place, but being the one to open up the opportunity for that conversation. And then, yeah, for sure to take ownership of, whatever part you played in that as well too. So again, these are people that are coming in that are very vulnerable and a lot of wounds that are open, and we don't know, how we could tread on those incorrectly. And it's a relationship, we're building and growing, and it's a huge opportunity to strengthen that alliance even more so once you get through that appropriately.
I think the piece that, if I want to like stress for those that are listening and you have a rupture, is to, yes, there are ways we repair it and take ownership and confront it and make an observation about it, take the willingness to take the responsibility on as us to work through it with a client. But the thing that I like would stress is that be thankful for it, like be grateful for it, because what's happening between you and the client is happening out there in their lives too. And they don't know, they don't have someone that goes, hey, something feels different. Hey, I want to talk about this. It's like, let's sweep it under the rug and hope that the mountain that exists under this rug is never seen or stumbled over or felt. But the reality is they're willing to have something real happen between you and them. That's a real opportunity for something different, a different outcome than what happens in their real life. And even though I don't think they're fun, I don't think they're enjoyable, I don't think it's comfortable, I don't love it, I'm grateful for it, because it means that we finally gotten to a place where I think the real self comes out. So we get to see them, this person, this wonderful experience in front of us kind of unfold and have the chance to have a different outcome to a conflict, because in life, it's probably not that kind of outcome that they'll have with us. And I think that to me is incredibly curative, to have a different outcome from a conflict with someone that's there in a relationship that really cares about you.
2 thumbs up, totally agree.
Yeah.
Good, well stated.
That feels like a really good place to stop. Thank you guys for chatting with me today.